Okay. Is it okay to go ahead and start? Okay, awesome. Thank you everyone for such a fantastic introduction and for being here. My name is Stacey Bartlett, and I'm going to kind of do a quick sort of introduction and kind of framing of the project, and then I will hand it over to talk the bulk of the time about the cash transfer component of it. So, the research project of Embrace is 4TM-ICC, which is a lot of acronyms. But we'll get into a little bit about what those things mean. But the reason why we are doing this, the reason why this was, the choice for our research project for the Embrace Center is because we are not great at maternal health in America, and we are particularly bad at it for Black women, and we are incredibly bad at it here in Pittsburgh, unfortunately. So the rate of Black maternal mortality is higher than 97% of comparable cities. And the reason why we focus on the postpartum period is because we know that more than 50% of the deaths that occur are actually after delivery, as opposed to during pregnancy or sort of immediately in delivery, but are occurring after delivery. So, the Embrace Center is focusing on postpartum care and the care between pregnancies, which we call interconception care. So, what happens between one pregnancy to the next pregnancy, and trying to improve maternal and reproductive health equity in Allegheny County. And there are a few components to that. One is to do research in an interdisciplinary fashion, and then to use that to try to develop some interventions at different levels, and then training the folks who are interacting with our postpartum women and birthing people, and then collaborating with community and with organizations to try to develop a better model for how we can provide better care to our postpartum people in Pittsburgh. So to that end, we have three aims for our project. The first aim is to evaluate the clinical and sort of person-centered outcomes of people who have already had this ICC 4TM care. So a little bit of background, there's an organization called the Implicit Network, which is a consortium of about 37 family medicine, mostly family medicine, some pediatrics sites. And I've been a part of that for 6 years now. And so most of the family medicine sites, the practices in Pittsburgh, are have implemented this program, this interconception care and 4TM care. It's just a model of postpartum and interconception care. But we've never been able to actually evaluate whether it works. So the first aim is really to see, is that actually working, what's happening right now? So we are doing both a quantitative and a qualitative approach to figuring out the answer to that question. We've developed a quantitative working group and have a lot of data, so much data from deliveries that have happened over the past sort of 8 years, 59,000 dyads, so mom baby pairs. And right now we did all the work to kind of get that data requested and refined, and we are now trying to define our exposure and our inclusion and exclusion criteria to see exactly who are we going to be comparing. With that knowledge of what seems to be working, what seems to not be working with this model, we are then going to develop with our community core, with our community component, a new model of care that is more community informed. So when the initial implicit model was developed, it was very physician centered. It did not have a lot of community, patient, staff, like none of that was really taken into account. So we're trying to build a model that actually is more more receptive and more salient and useful for our community. So we've done, to that end, we've done focus groups and interviews with physicians, with residents, with staff at the current sites, and we're currently figuring out how we're going to analyze that. And then our next step will be to talk not just to the clinicians and the staff, but to the actual postpartum people. And so that's where our next step. And we've got all of our approvals ready for that. So it's just kind of moving into the sites very soon, we hope in the next 2 weeks. And our last aim is to implement this model across some of our current implicit sites, and trying to use some implementation science to figure out how to make the new model of care that we develop as useful as possible. And within that aim 3 is our cash transfer, which I think is what we're gonna move to. I think it's the next one. Is it? Yes. Okay. So yes, that's that's the segue from the bigger picture of what we're doing, and one of the really exciting things that is a part of the research project, which is the cash transfer pilot. So I will turn it over to Dr. Krishnamurti and Dr. Martel.
Thank you. Thanks for having both Kim and I here today to talk a little bit more about the cash transfer pilot. Maybe we can go to that. Yeah, thanks. And so, you know, what we want to talk about today is kind of what a cash transfer pilot or program is, what we think will make a cash transfer program successful in Allegheny County for Black pregnant and postpartum people. We couldn't do any of the work without this fabulous Embrace team and cash transfer team specifically. So just wanted to acknowledge the folks who have been working really hard to help us plan for this part of the work before we dig into the details. But let's dig into the details. So Kim, maybe you can take the next slide away, and then I'll jump back in when you're ready for me.
Sure. So, yeah, so thank you so much for having us here. And although I come to you from Los Angeles right now, I did my graduate school study in Pittsburgh. So it is a location that's dear to my heart. And hearing you, Stacey, talk about the challenges specific to Allegheny, it really highlights the need in this area. So I really appreciate the opportunity to do this work. And as we talk about cash transfer and guaranteed income, my state, California, your state, Pennsylvania, although they're I claim them both, are really kind of at the forefront of some of this work in many ways. I was recently able to be at a talk that Dr. Amy Castro gave, she's at Penn, right across the state from you guys. And so there's a lot of really amazing, innovative work going on. And so really excited to be able to talk about this today. Before I get started, I kind of wanted to just level set on just by sort of an emoji reaction, how many of you is cash transfer or guaranteed income kind of a new concept? One you haven't worked with before? A few people, okay. So that's super helpful because I think I'll probably set some of this table, and then sorry if I'm going into too much basic detail, but I'll try to move through it a little bit. Claire, maybe just the first set of bullets would be good, or if they're all there, that's fine. Okay, so the cash transfer movement, right, is an idea, a set of people doing this work all across we'll talk about the country. There's many international ways of doing this, but we'll mostly be talking about the domestic ways of doing this today. And it's an idea that 64% of Americans are living paycheck to paycheck right now. And one of the best tools that we can use to help people is by giving them cash. It is a proven tool, and it's something that is easy to understand, and it's something that's pretty universal. So some people ask, is this universal basic income? Is this giving guaranteed income or direct cash transfer? Is that universal basic income? And it's related, but it's slightly different in that universal basic income is meant to go to everyone and to provide enough money to cover all basic needs. Whereas a guaranteed income intervention or a direct cash transfer is actually meant to establish more of an income floor that nobody can fall below, sort of theoretically. But another advantage of it is that guaranteed income can be implemented through things like through the tax code, through implementing or expanding existing policies like the child tax credit, earned income tax credit, other mechanisms that exist already to provide cash to people. And it often has a time limited sort of constraint on it. So I would give you more background, but I think that to speak this bridge between sort of generally what the cash transfer movement does and how it relates to this particular project, this amazing person, Ayana, who I'll tell you a little bit more about her in a second, could say it better than I can. So Claire, let's see if the video works. Fingers crossed.
Let me just reshare so I have my, so I'm sharing the sound. Sorry, I didn't do that to start. Oh no, we're good. Okay, trying again.
You want to know the best prenatal care? Financial stability. You want to know one of the best mental health hacks? Financial stability. You want to know one of the best tools for crime prevention? Financial stability. People love to say money can't buy you happiness, but not having money can't buy you a whole lot more. Like a roof over your head, like groceries, like prescription medicine, like childcare. And when programs are put in place to give people financial stability, all of a sudden people have an issue with it. And it always seems to be the same people who swear they're so passionate about the children, but when it comes to ensuring that the children's parents have the necessary resources they need to take care of the children, all of a sudden y'all want to get selective. Guaranteed income is a strategic initiative that offers a limited amount of direct cash, unrestricted, for a finite amount of time. And y'all aren't actually anti-guaranteed income, because y'all definitely accepted those stimulus checks with your hands wide open. That was a form of guaranteed income. For example, in Flint, Michigan, there was a guaranteed income program called RX Kids. And RX Kids gave all expecting mothers $1,500 during their pregnancy and then $500 a month for the first year of the child's life. And studies showed that RX Kids lowered maternal postpartum depression, it allowed families to be more stable in their housing, and it improved infant outcomes like low birth weight and prematurity, which then resulted in less NICU admissions, which then saved the city of Flint $6.2 million a year. And now there are bills to restrict advancing more guaranteed income programs. If it's allowing people to have a roof over their head, if it's allowing them to afford prescription drugs, if it's allowing them to afford childcare, what is the issue? Guaranteed income works, and it provides people with the power and the agency to make choices that ultimately save the children. Because that is what y'all care about, right? The children.
So I encourage you, I know, right? She's so great. So part of the reason why this video even came about is because there is a really strong community of practice and group of people who are doing this research. So this is a video that comes from a group called the Guaranteed Income Community of Practice, actually, but they have a small working subgroup that is focused on storytelling and communications, and they work with different people, but in this case, a social media content creator, to like get out this accurate information, but in a way that speaks to the right people, is really authentic, and really explains like why this could make big change. So I wanted to show it to you just because I feel like they're doing a lot of really interesting work, and we just, really love our partnership with them as well. With that background, there are some different types of things that are related to cash transfer. So one method that you might be a little more familiar with is more of a conditional cash transfer, where it's sort of like, we will pay you money if you can do these positive health behavior changes. So Tamar and I have done some work with people in substance use, the substance use area, where sort of you're paying people for example, like clean urine results. And as they produce more clean urine results, you're giving them more money. And there's many studies that show that that's one of the effective ways to support getting people into treatment and keeping them there. But one of the major problems with this is, number one, it feels people don't love it. People are like, well, you could just give us the money and trust us a little bit more. So here is a benefit. Well, that is one of the main benefits of unconditional cash transfer or guaranteed income, is that it really leans into trusting the people to know what is best for them and how to use this money, what they actually need. It's a little bit harder to advocate for on sort of the policy side, because it does mean you actually have to have trust in the people that you're giving the money to, which often that can be a barrier. So it's not contingent on behavior, but you can help promote it. So a lot of guaranteed income studies don't actually just give money and then walk away, right? There's often a lot of supportive programs around it. There's more education, much like this one that we're talking to you about today. This is just one component of the larger project, like Stacey was saying. So we're hoping to wrap around the rest of this, be able to make it more possible for people to access these amazing services that are being given or given the opportunity to. Sometimes people say that cash is really the gift of time, because that is really what you're giving people in a lot of ways. So even in these uncertain and scary times, there is some traction being built with this, with policymakers, nonprofits, foundations, researchers behind this work, because it works. So you heard Ayana talking about RX Kids, which is in Flint, Michigan. One of the most famous pilots of this was in Stockton, California, often called the Stockton study, also showed really good employment outcomes. And another one that is kind of closing now that I think is really interesting is the Boost program, which gives money to students in community colleges. And one of the places that they saw the biggest impact was on student parents. And because, again, this idea of the gift of time, if you're giving people money, direct cash, while they're in school, it gives, and especially for parents, it gives them the gift of time. And the outcomes they're early, they haven't published them yet, but they're saying, you know, what people are saying they're using this for is putting their kid in an after school program, you know, giving them the opportunity to engage with their own kids more while being students. So I think that there's a lot of really amazing work going out there. And so building on the other people's work, we really wanted to talk just briefly about some of the keys to successful implementation of a study like this. One, people always want to know how much money, like how much money is the right amount? When do you give it? All of those things. And of course, in terms of effective amounts, everyone's like, more is better. Give people more money, they're going to do better. But often matching to local income levels is really important. And, you know, sort of as a best practice at this point, many community level interventions are using about an 18-month minimum if possible. But when we were talking about it at this meeting I was at, you know, those numbers, those things are shifting over time. But one kind of bracket that people are using is to not give people below about $750 a month if you really want to make change. And which it, again, really depends on where people are. And then in terms of above, a lot of, I'll talk about this in a second, but one of the things that you really have to be worried about is people not losing benefits, right? You don't want to give them too much money so that takes them out of the categories of eligibility for other benefits. And so one of the things that you can do is designate guaranteed income as a gift instead of as income, which that's why some people just say direct cash, because if you call it guaranteed income, then people are like, ah, that is income. And so keeping it below the threshold of the gift amount, the annual allowable gift amount, is another sort of large frame for that. In implementation strategies, there's many different types that you can use. The idea of a lump sum payment that can really have a certain impact. Maybe people need to do something like fix a car, start a business, get into an apartment. With things change like that, a large lump sum payment in one time can really make a difference. Or if you have it over time, sometimes people can actually use that to establish like an income stream so that they can do things like be in support of housing, things like that. So there are different benefits of different strategies. Things like cash versus electronic transfer, engaging people in traditional banking if there are individuals who don't access that typically. Again, the benefits criteria is a big one. Partnering with policymakers, government entities, other providers are super essential to help educate people about what could happen when they receive this cash. The benefit cliff, right? You don't want them to lose any other potential benefits that they have. In different states and entities are doing things like having waivers. California right now has a statewide waiver that you can't lose certain benefits if you're getting guaranteed income. But that is something that you have to be really cognizant of when you're doing these kinds of programs. The other really important thing that is sort of the biggest marker of success when we were looking at these programs across or talking to different programs is the programs that do the best are the ones that are community centered and come from the community. So That means they're nested within an ecosystem of other services. That means you can tell in the way it's designed and implemented. It's implemented by members of the community. It's, you know, there's a lot of involvement and engagement at every step of the way. Those are really the programs that are having the best possible outcome. So there's really strong support for doing the work in this way. And of course, you know, you want to center those most affected, and in everything you do, right, demonstrate respect, dignity, trust, autonomy. These are things that I love working with this group on, because this is already ingrained in all the work that you're doing. So you'd be surprised at the number of other groups you have to go to and be like, hey, this is super important. So I know you guys know that deeply already. And the last thing I'll say before I turn it over to Tamar is just that, you know, of course, these interventions are great, but really systemic interventions are needed in order to make this kind of change. It's really interesting. So that Boost program that I talked to you about, that is the one that they're giving money to students in community colleges. It's been so successful that that network of, I think, 12 community colleges is creating a new system going forward that it's part of the infrastructure instead of a separate program. And I really feel like that's the way that we're trying to go. So if we can use these pilots to then advocate for organizations, systems, to then build it in, that's going to really be where we can make the most change. Okay, I think I'm handing it over to Tamar.
Thank you, Kim. So with Embrace, we have this incredible opportunity to implement a small but mighty, hopefully, pilot of providing cash transfers to postpartum individuals who will be part of the kind of 5 Pittsburgh implicit sites. And so that will happen, as of now, that's planned to happen in the spring of 2028 to start. So we have a little bit of time. And so we've been spending time really learning, as you know, as Kim presented just now, learning lessons from other programs. We are tracking the existing programs that are really focused on maternal health. And we have a list here. It's so small that I'm not expecting you to see them all, but we just wanted to give you kind of an overview of the number of programs. There are about 30 programs happening or that have recently wrapped across the country of all various sizes that focus specifically on providing cash to pregnant people or to new moms. They are predominantly in California. I bolded that at the bottom. So we have a lot to learn from our colleagues in California. The most popular duration of cash transfers is about 18 months, as Kim mentioned, and they mostly provide around $500 a month over the course of that 18-month period. A lot of programs are focused on geographic areas with large Black or BIPOC populations, but most are not using race as a criterion for enrollment in their programs. And most of the programs are looking at improving financial stability. That's the kind of primary outcome that they're measuring, but also looking at improving infant outcomes, supporting maternal mental health, so trying to think beyond just financial stability, but seeing how those effects might trickle down into kind of health and well-being in other areas of family life. And then I just want to very briefly mention a recent study that was done that looked at all the cash transfer programs that were providing cash to pregnant or postpartum people, and that look specifically at postpartum outcomes, things like breastfeeding and mental health and parenting. And I want to mention the study because it highlighted 2 things that I think are going to be relevant to Embrace and to the work that we're doing. So one is that there is still a lot of opportunity for us as a group to examine how these cash transfers affect specific postpartum outcomes for new moms. And that's something that as a group that we're hoping to kind of work on and decide what are the postpartum outcomes that are really important to people that we should be focusing on. The other thing that I wanted to mention from this study is that a lot of the programs that they looked at focus on providing money once a baby has been born. But I think there's also an opportunity to extend cash transfers into pregnancy when people may need additional support to help get the prenatal care that will, you know, help aid them in having good pregnancy outcomes as well. So 2 things for us to think about as we later open this up into kind of conversation about how we think cash transfer program in Allegheny County should work. Okay, so just a little bit of background, and I should say that when we wrote this grant, we had a kind of a limited budget for what we could propose, and also the kind of science and understanding of cash transfer programs and structures is constantly evolving and changing. And so at the time we wrote the grant, our Embrace cash transfer pilot was proposed to provide a cash transfer to participants from these select implicit sites to roughly reflect what kind of current standards of short paid parental leave would be. So this is like a minimum wage of $15 an hour for 8 weeks. We wanted to be able to at least give people that kind of cushion in cash. The plan is to enroll them in pregnancy, but to start providing payments after delivery. And we currently have the budget to do this for 30 participants who would receive cash, and then 30 control participants who would kind of complete surveys and interviews with us, but would not receive that same cash transfer. And then we plan to examine how people spend the funds, talk to them about what they find the funds useful for. This is to kind of generate evidence of the usefulness of implementing this kind of program and pairing it with kind of healthcare delivery. We want to look and see whether those funds help people to access healthcare services, things like, will that help them attend their postpartum visit, if it can help them cover transportation or childcare. We want to see how providing additional cash would affect mental health symptoms, because this seems to be very promising as something that can be impacted in other studies and programs. And then based on work that Kim and I have done with other populations, we want to see if funds can kind of help people feel and stay socially connected and support their own experiences of resilience. But really, this is a small pilot. And so what we want to do is use the opportunity to make sure that we can successfully implement a pilot like this. We can disseminate it through kind of a prenatal postpartum care setting in order to help it to grow into something that's larger and longer term. And so there's a small goal to reach a big vision. Okay, so we've taken some first steps just to try and think about what will make a program like this in Allegheny County a success. So our team has been pretty hard at work reviewing existing literature on programs that provide cash transfers to pregnant people and postpartum people, so that we can understand what are the design features that make them successful, how many of them are using a community partnered approach, and how are they actually implementing that? Where are kind of people shaping the design and implementation of these programs? And then to supplement that literature review, our team's also been doing interviews with administrators from the programs, from that kind of table of programs that I showed you earlier, to learn about their successes and their failures, so that we can come into the design of our pilot really knowing what's worked before and what hasn't. And then we've also started listening to moms in Allegheny County, both through PRAM's survey data and through listening sessions, to see what is people's interest. How would they like to receive the payments? What do they think they would use those payments for? What are their concerns about how this would be implemented? And so we still have a lot of listening and learning to do, but this is kind of the beginning of the approach we're taking to think about how to structure the program. And then this is just a timeline of our next steps before we launch in 2.5 years. Kind of feels like a long time. But I know it will happen quickly. So one of those steps is building a working group to help us with our pilot design, and to do things like work together. As Kim mentioned, one of the concerns is making sure that we don't provide cash that would make somebody ineligible for other benefits that they're eligible for. So one of the things we'll be doing is kind of working together to review and execute a benefits protection toolkit. We'll be thinking about how to structure payments, when to give payments, how to think about kind of communication if somebody is receiving a payment, but their next door neighbor or their really good friend who's pregnant at the same time is not receiving that payment. How do they navigate those feelings and those conversations? And so that's part of the work of this working group, and we would love you to reach out if you're interested in joining us for that. And then we'll plan to secure additional funding and support, because even just talking through this, I know that doing this for 30 people is not going to nearly be enough. And with the amount of money that we would like to give people, it's not nearly enough. And so we have kind of big dreams for expanding, maybe even prior to our launch. So can we go to the next slide? Because we'd like to put out there some of our vision for how we would like to expand this, not just more money, not just longer time in the program, not just more participants in the program, but also more that we can kind of learn from and do with this program. And so, you know, part of that working group's task will be thinking about how can we make it bigger and better, and where can we get additional support. And I think, you know, if we hit the ground running, we can make really big impact. So some of the things we've initially started brainstorming on internally are things that we have here. So we think that we could provide cash support, to improve clinical outcomes. So this is things like transitioning to primary care or managing high blood pressure. These are things that we think are movable, but have never been looked at in the context of a cash transfer pilot before. Some of our team have been working on building a postpartum support app, and that's in partnership with the state's Department of Human Services, and that's going to be made available to all new parents in the state of Pennsylvania in the spring. You can see a kind of a visual of some of the screens of the app on the slide. The app is called Mayana. It stands for Mothers You Are Not Alone, and it was designed to do a few things. It was designed to help new moms track and understand their postpartum symptoms. It's designed to help support positive parenting and healthy infant development, and to connect families to local resources, among other things. And so one of the things we've talked about as well is the opportunity to use Mayana alongside our cash transfer program to better understand new moms' experiences and learn what additional resources and supports they may need to mitigate postpartum risk. And then Kim has also done some interesting work that maybe you can talk about a bit more, Kim, on pairing cash transfers with kind of training and providing job opportunities. And we see that as a potential way that cash transfers can support people getting back into the workforce after having baby, if that's something that they desire to do. And so we have, to illustrate, we have a lot of different working ideas of ways we want to expand. And I think maybe we could just turn it over to everyone else now for kind of Q&A and conversation.
Thank you so
I'm
much.
very impressed you ended right on the money on time. I'm very impressed with that.
Yes, absolutely. Thank you so much for great speakers. We'll open it up for any questions. Oh, I see a hand. Is it Tamika?
Yes, it is. Good morning, everyone, or afternoon now. So I have a question regarding, you said one of the things that you're trying to do is not affect any of their other benefits that they're receiving. So I'm curious to know how, if you're in communication with other agencies or organizations, because I'm a family coach with the Hello Baby Priority Program, and DHS has just rolled out a pilot program pretty similar where they are providing a gift card, so to speak, or they're providing monetary awards to some of our participants. So if they're receiving money from DHS also receiving money from a program like this, how does that affect their other benefits?
Yeah, that's a super good question. And I would say that, and that is one of the ones that every guaranteed income program is really making sure they address, because that having negative unintended consequences for the people is the worst possible outcome, right? And so kind of what Tamar is talking about, how building like a benefits guide, there are many of them out there, but the thing that people are doing at this point is providing almost like one-on-one coaching for people, because people's individual situations are quite different. But what we found in other programs is that you can kind of have categories, right? Like if these are the types of benefits you're receiving, here are the things that you need to, here's are the letter to kind of set it up for people to ready. It's like, here's the letters that you need. You have to set up all the waivers, everything in advance of starting the program. So people don't come to you and say, oh, my benefits got cut unexpectedly, right? You really, as the people designing it, have to be way ahead of the curve on that. And to say, let me explain to you what might happen in engaging in this program. I work with a lot of trans and non-binary folk, and they are, in order to engage in some of these programs, there was a lot of questions like that in advance, not just in terms of benefit cliff things, but all sorts of things. So really having that pre-work up front to say, okay, here, tell me any other programs that you are participating in. If you're receiving this, we look at the numbers, we look at the amounts. There's actually like a calculator dashboard also that people can use to do it on their own, but I really recommend that people don't do it on their own. They really do it with a benefits counselor. And you, as a person who's supporting family, not that you would have to learn that yourself, but that you would be able to be linked to somebody who really is well versed in that, and they would be able to coach people through the benefits part in particular. It's a really important part of guaranteed income. So to me, I don't know if that answered your question.
It does. Thank you.
Thank you for that question. I'm going to go quickly to the chat as a little bit of a follow-up, and then to Charisse. And they said, Christina says, speaking of other benefits, will participants have to report these funds when filing taxes? So that's something to consider.
Yeah, so
supporting.
It kind of is program dependent, but most programs are trying to, for instance, designate it as a gift. And you have to do that from like the entity side when they're issuing it. So we have had some success in large institutions who are giving the money to designate it as a gift, because that is one way to sort of get around the idea that it is not income. The idea that you're not getting it in a sustained manner over time also means that it's not income and should not be categorized as income. So that is another reason why using things like tax credits and things like that is kind of a good mechanism, because then those questions are kind of already answered in advance. So we're trying to avoid it as much as possible as having to be reportable income on taxes, but there are programs where they've had to do that, and frequently the program will withhold the taxes and then pay it as part of the program expenses. But that is especially in a program where you might be doing things like employment support. If somebody's in a certain situation and then you help them enough to get a job, and then their tax circumstances changes, you don't want them to then be hit with this as part of their tax. So it's a really important conversation to have. So, but people are trying to avoid that as much as possible. Thanks, Christina.
Thank you. And Kim, there is a follow-up in the chat that maybe you can answer in the chat. And Charisse, we'd love to hear your question.
Hi, I just wanted to speak on behalf of RX Kids. I'm from Flint, Michigan, and work alongside them. Our organization is Mothers of Joy Institute, and we're considered to be aunties connected to that program. What you're speaking on is how that program is actually designed. They use what's called like a dowry kind of system. So it is showing what Miss Kim just stated, that is considered to be a gift. So since that's done, it won't affect their income, and it's more or less to help the baby in the family. So they're trying to show where it's not a threat per se, but it's actually truly a help. Because parents have talked about that they've really it's really helped them along the way. Because if you think about it, you have something that's coming in that you don't have to worry about per se. That you know that you can use it for whatever you need to use it for, and it's not being monitored. You'll do something. We're noticing that the moms are doing things particularly for their family, and they're reporting on it. So I believe if you give people an opportunity, they'll say they'll do something well with it and not negative, right? So I just wanted to share that.
Sharice, in a follow-up, may I ask, are the aunties giving the funds through,
We
like, are
don't
they
get the
directly?
we aunties don't get the funds. We just generally we work with the parents. So my program is a family education program. So if we come into contact with a new mom and we know that they haven't been connected, we do the connection. I'm also a part of Michigan State's social determinants of health. And so it's just actually those we call them continuum of care services where
Mhm.
we do a lot of the wraparound so people aren't missed, because a lot of time people miss opportunities just because they're not connected.
Awesome. Keep us posted on evaluations and information. That'd be awesome.
I surely can get that information for you.
Thank you. What other questions do people have? Let's check the chat. So the question was about the W-9 was saying it's dependent on the program. If it's designated as a gift, you should not have to do a W-9. RX Kids has an amazing toolkit for programs on how to do the benefits part of this. So undoubtedly our team is checking that out. And also, Sharice, just thank you for your incredible work. You and all the aunties. Yes, yes, yes. That's awesome. I'm so glad you're here with us. Maybe joining the work group, who knows? Helping inform. We really do have to. What I love about Embrace is us breaking down barriers of our university, and we can't connect with, in real meaningful ways with the other because we're in competition and things like that. I think we're growing our network and growing our family and village. That's the auntie being here today.
Well,
So
I'm here on behalf of Mothers of Joy. I'm connected to those other entities, so
yes.
no worries.
That's awesome. That's awesome. So now you're connected to Embrace. Yay. Mr. Art, did you have something to say? I thought you came off mute, but I'm not sure.
Mm,
You're okay.
I did, Dr. Lovey. Thanks for acknowledging the trouble I have sometimes with electronics. Um, my question is this: Tamar mentioned that you guys have done some initial work with talking to people around listening sessions and things of that nature, where they were able to identify potentially what they would use these funds for. I'm interested if any of you can share just kind of exactly what's come out of that preliminarily, if possible. Thanks.
Yeah, so we still have a lot more work planned in terms of speaking both with providers in the healthcare system who will be kind of championing and supporting this, and with perinatal individuals who will be the recipients. But even from the PRAMS data, we asked people, what are the ways you might imagine using the money if you received it? And so I can kind of read the categories. Oh, someone has it. Amazing. Okay, so you can see the categories here. So baby items, right? You suddenly have this new additional expense in your life. And so people want to apply this money to covering some of those baby expenses. Food, housing. So, as Sharice mentioned, these kind of social determinants of health or social influences on health. Things that like childcare that would actually make it easier to get back to your appointments. Not every healthcare facility has an option of daycare or childcare, or they have they have constraints on that in terms of like being out of diapers, and those things make it difficult to get to appointments. Other household services, entertainment or activities, things to bring you joy, which we strongly hope that people will use funds to bring themselves joy and connection. And then education, employment, or business related expenses. And that has really kind of motivated us to think more about what are the other things that we would need to put in place to help support people if they want to put funds towards education or businesses, you know, how do we support them in kind of the infrastructure to realize that goal as well?
Thank you, Tamar.
Good to see you. I haven't seen you for a while.
I'm gonna invite voices from our community representatives. If you'd like to share any thoughts about the potential promise or pitfalls, also anyone working in policy, if you have any reflections, things for us to be mindful of. And if not, others. All right. We may have been so thorough as to exhaust questions at this point. Um, this has just been a beautiful session, and I think the thoughtfulness and garnering information and insight from a broad range of people is vital. I love that the team is thinking so deeply about the potential impacts, the unintended consequences, downsides of the resources. And I know one thing that I learned years ago when I stayed during an internship with a single mom, and it was amazing to me that how broadly she shared her resources. I mean, someone in need. I was in need as a student, staying with her for very little compensation, I'm sure, but just to witness just her strategy in sharing was quite amazing. So I would imagine that someone, even a person with that, let's say it was even a single parent, would also be thinking of their neighbor. And so I think it's going to be a beautiful experiment, um, and a beautiful trial, and hopefully we will find funds to give it out to more people. And Ghazi says she's just so pleased to hear about this pilot coming to our area. California is often the leader in innovation for much of the country, and we often look to and Ghazi often looks to their research for lactation information as well. And then Kim, yes, mutual aid is a really interesting area for sure to look at as an outcome. That would be amazing. Kim, I was so impressed also that you work with the National Child Traumatic Stress Network. I think that some of this will honestly have an impact on, the stress level of parents and the vulnerability of children, and reducing some of that. So lots more social determinants, I hope, will be affected by this. Sharice also put in the Mothers Institute parentingwell.com. So thank you. What is that?
I'm just sharing. That's our program here. Yeah, where I'm at. We pause after thing adding right
Is
now.
Sharice cutting out for anybody else?
The
Okay.
I probably internet connection is not good. Can you hear?
You know what? Maybe try turning off your camera and see if that works. You started cutting out.
Can you hear?
Ah, can you hear?
That?
Ah,
I'm
I think.
sorry. Can you hear
Oh,
me?
wait. Okay, I think we can hear you now.
I was saying that our city right now is really hard on our homeless population with the weather that is coming, making sure that the most vulnerable have a place to stay. Our housing is very limited, and so not that our program has shifted. We still are doing parent education and all of the things, but when emergencies happen, you go to what needs to be done. So that's where we are right now, and working with the children and families that are are going through those things. So yeah, so that's that. And I seen the email for this and I was so excited that I was running from a client's appointment. So that's why I was a little late. So I was happy that I could get in, but my connection has been really acting up, like Art said, the whole internet and technology thing. I'm glad that we allow each other grace because it can be so difficult. You want to do stuff and it cuts you out or knocks you off and you got to get on your phone and then the screen's too small, all of the things. But thank you all for just doing what you do. I don't know everyone here, but I know if you're sitting in a box at almost 2 o'clock, it's important. So I appreciate you and thank you for including me.
What a heartfelt message, and we thank you. And we also, yes, we practice grace regularly as tech fails us or throws us for, challenges or opportunities to try different methods. So it's worked well today, and we're so grateful everyone got to get on. I want to encourage you as you do this work to remember to breathe, remember to practice self-care and wellness so that then you have something to pour from, that you have an overflow and you're not draining yourself and harming yourself in those ways. So be mindful of that. And I'm going to turn it back over to, I think, Ngazi or Linda to close this out and share what's next.
Yes, thank you so much, everyone, for joining us. Thank you to our amazing speakers. This was a really lovely presentation, really fruitful discussion time. We hope everyone enjoyed today's seminar. I just put a link in the chat to our seminar evaluations, so please take a moment to fill those out. It's really short and it helps us plan for our future seminars, so please take a moment to fill those out. And then just 2 quick announcements before we all head out. I know it's 2 o'clock. But first one is that we hope to see you at our next seminar, which is Thursday, December 4th. We'll have Dr. Lisa Parker speak to us about ethics in reproductive health research. This will be a hybrid session, so we'll have some Zoom attendance and then in person. Please note a change in the schedule. Dr. Monica McLemore was originally scheduled for December, but she will have to join us in January. So we look forward to both our December and January speakers. And then our last announcement, which is really exciting, we want to announce our request for applications for community engaged research pilots. So applications will open on Monday, so keep an eye out on your emails and the website for that. And they'll be due December 15th. So we're able to fund up to 3 projects and provide up to $10,000 in direct costs per project. Projects must include a community co-lead and an academic co-lead who is affiliated with one of Pitt's schools of health sciences or UPMC McGee's Women's Research Institute. So again, be on the lookout for more information. Feel free to reach out if you have any questions. But again, thank you all for joining us today.